Research shows that exercise in cold environments can have a substantial impact on one's health and exercise performance. Many factors play a role into this, such as acclimatization to the cold, hydration status, body composition, clothing, and other factors. It is important to be educated and take preventative measures in order to keep those exercising in the cold safe and performing at their best. Common health risks that may occur due to exercising in the cold include a decrease in cognitive function and proprioception, hypohydration or dehydration, frostbite or frostnip, issues with respiratory diseases, and other health impacts. Both elite and recreational athletes, as well as those in the military and those who work out in the cold, can be negatively impacted by these effects if they are not cautious.
Studies have shown that those who are acclimatized to cold climates may not be as greatly impacted by cold weather in comparison to those who do not spend a great deal of time in the cold. For example, a recent study set out to determine if men acclimatized to the cold displayed a higher economy during a graded cycle ergometry in the cold at 5 degrees Celsius. Economy is defined in this study as oxygen uptake per unit of body mass required to accomplish a given sub-maximal workload. The subjects consisted of cold weather athletes and physically active men. The study said at sub-maximal workloads, cold acclimatized men have higher exercise economy than non-acclimatized men. This means that cold weather athletes were more resilient to cold-induced performance decrements than physically active men.
In relation to this, another recent study looked at how a cold climate can impact a person's cognitive function and proprioception. Elite and recreational skiers were studied to gain information on how an acclimated individual, the elite skier, would compare to a non-acclimated individual in regard to cognitive function and proprioception. According to the article, proprioception corresponds to the ability to determine and coordinate body segment positions and movements in space. The study showed that elite skiers had a significantly higher proprioception acuity than the recreational skiers. Elite skiers were also able to maintain accuracy during the cognitive task in the cold climate, while recreational skiers' accuracy decreased. In addition, recreational skiers noted having more negative effects such as pain and discomfort when exercising in the cold in comparison to the elite group. Exercise in the cold can also bring about hypohydration or dehydration. Dehydration occurs when there is a harmful reduction of water in the body, which can happen during exercise. While many studies focus on water losses from exercise in warm environments, exercise in cold environments can cause substantial water loss as well. In either environment, dehydration should be prevented at all costs. Dehydration leading to a greater than 2% decrease in body mass loss can have a negative effect on physical and cognitive performance. While more apparent in hot and humid environments, water loss in cold environments can occur from sweating, reduction in voluntary water intake, and diuresis. Studies have shown that voluntary water intake is less in cold environments than warm environments. In addition, exercise in cold environments can lead to a blunted thirst response depending on the duration of the exercise.
A reduced voluntary fluid intake, thirst sensitivity, and poor access to water, all with the sweating caused by both exercise and bulky winter clothes, may cause hyperosmotic hypovolemia, which can impair vasoconstriction during sedentary cold exposure. These fluid losses can cause isoosmotic cold-induced diuresis or hyperosmotic sweat loss hypohydration. Hyperosmotic hypovolemia blunts vasoconstriction during sedentary cold exposure. Exercise in the cold also increases cardiovascular strain, causing individuals to become fatigued more easily or decrease their intensity.
While the occurrence of dehydration in cold environments is less than in warm and humid environments, it is important to ensure that athletes are properly hydrated regardless. Similarly, ensuring that athletes are wearing proper gear can have an impact on the body's physiological functions as well as performance. Hypothermia and frostbite are also two health risks that can happen when exercising in the cold. Hypothermia is when one's core temperature decreases to 35 degrees Celsius or less. A lethal low body temperature would be between 23 and 25 degrees Celsius. Frostbite and frostnip are also health risks that can harm the extremities. Frostbite is the actual freezing of the body tissues, while frostnip is a non-freezing injury which can be followed by mild frostbite. For this reason, wearing proper protective clothing in the cold is essential for prevention. Military and factory workers are often at increased risk when they complete barehanded work in the cold. One study tested subjects barehanded for 90 minutes in acute cold exposure in comparison to subjects doing 30 minutes of interval or continuous exercise. The acute cold exposure group noted feeling colder and more hand pain. Though the exercising subjects felt more comfortable, improper clothing can put one at risk of hypothermia, frostbite, and frostnip.
Restrictive protective clothing poses greater stress to the person wearing it comparatively to normal clothing. Additional clothing layers adds bulkiness to the person wearing it, but the main concern for discomfort comes from the cold protection for the hands and fingers. Increasing the clothing layers increases the metabolic rate. Wearing the NBC, nuclear, biological, and chemical clothing, has no risk for hypothermia, but it does increase the risk of heat strain in cold weather during strenuous activity. Skin temperature is affected due to the changes in metabolic rate during cold weather exercise. The NBC clothing increases the metabolic cost due to the restrictive movements and increase in weight on the body while increasing the stiffness of the body, causing one to hobble and expend more energy. During moderate work or the beginning of exercise, there is a decrease in performance due to the redistribution of circulation and increase in vasoconstriction in response to the cold. Wearing mittens delayed or even prevented the decrement of finger temperature, even if they cover the rubber gloves. Subjects with asthma had the highest prevalence of shortness of breath during exercise in cold climate. Persons with allergies or bronchitis had a higher prevalence than healthy persons. Current smokers had a higher shortness of breath in all categories than among ex or non-smokers. Family history plays a key factor in the risk for obstructive airway disease or allergies. Skiers did not have a significantly increased risk for asthma or respiratory symptoms. Outdoor workers do, however, have a risk for shortness of breath in cold weather and bronchitis that is higher than those who work indoors. Asthma is not significantly elevated by regular exercise or by working in cold climate. Living in a very cold climate for an extended period of time can lead to chronic obstructive lung disease known as Eskimo lung. Over 50% of top-level cross-country skiers and one-third of competitive figure skaters have asthma or asthma-like conditions with bronchial hyperresponsiveness to exercise. Among non-smokers, women had a higher prevalence of shortness of breath, while men had a higher prevalence of shortness of breath in current smokers. Chronic bronchitis significantly increased with age.
Exercise-induced bronchospasms are another respiratory disease looked at in relation to athletes in cold environments. Researchers have set out to test if exercise-induced bronchospasms occur more frequently in cold weather athletes. Bronchospasms are a phenomenon where there is a transient airflow obstruction associated with physical exertion. Exercise-induced bronchospasms negatively affect physical performance and health of athletes. One of the many common ways bronchospasms are diagnosed is a 10% decrease in FEV1. Exercise-induced bronchospasms have been concluded to be more prevalent in patients with asthma, atopy, and allergic rhinitis, and that bronchospasms do not happen as much to warmer weather athletes. Recently, a study set out to learn about the effects of obesity and ambient temperatures in the physiological responses. The study included both lean and obese patients. In both groups, there was a significant decrease in heart rate in the cold, but not a significant decrease between the two groups. In conclusion, the study found out found that blunting of the heart rate was more evident in the obese group compared to the lean. Blood lactate levels and rectal temperatures also tended to be lower in the cold than that of a neutral temperature.
In conclusion, many athletes, workers, and those in the military endure exercise in cold environments daily. Therefore, it is important to be educated on health risks associated with exercising in cold environments and be aware of ways to help prevent these risks that may jeopardize performance and put their health in danger. The more we can educate athletes and any active individuals in the cold, the safer they can exercise by being fully prepared for potentially hazardous weather.